and treating injury and violence. SABRE is a leader in injury and violence prevention research, offering access to expertise in the development of research, program, and policy activities, teaching and mentoring of students and early career researchers, collaboration with practitioners and policymakers with the goal of bridging research, practice, and policy. SABRE is also a very strong and present advocate for improved resources and funding in the field and has been focusing on advancing global injury and violence research and increasing membership of global researchers and practitioners. Membership in the organization comes with professional development and networking opportunities through our conferences, committee involvement, and webinars. Benefits also include a mentoring program designed for students and early career researchers, access to course syllabi, advocacy training materials and webinars, and discounts to our national conferences. Our next conference is in New Orleans in March 2015, and registration is currently open. Our benefits also include online access to the journal Injury Prevention, leadership opportunities through standing and expert committees, and access to timely information and position statements in the field of injury and violence. If you'd like more information about the organization, including information about the conference next year and member benefits, you can go to www.sabreweb.org. And thank you very much. And Terry, I'll pass the microphone to you to introduce the webinar speakers.
Hi, this is Lara. I don't hear Terry, who was going to introduce us. Are you there, Terry?
I don't hear her either.
Okay. Well, I'll do a quick introduction then. This is Lara McKenzie. I'm at the Center for Injury Research and Policy at Nationwide Children's Hospital. And co-presenting with me today are Jennifer Manganello, who's at the University of Albany School of Public Health, Kate Smith, who's at the Johns Hopkins Center for Injury Research and Policy, and Kristen Roberts, who is a senior research associate here with my team at the Center for Injury Research and Policy. I guess Terry is saying that she's blocked for some reason, so I'm going to just proceed and get us started. So we're really excited to present today to this group, and we thank the committee for accepting our webinar presentation, and we were really excited to see so many people register for it. So we're going to start today with the premise that the research findings that are typically published in reports and academic journals, venues that are rarely accessed by parents, who are a primary target audience for these findings and recommendations, and that injury researchers are increasingly active at disseminating and translating research, and we're doing this usually through local and national media. So that's kind of the premise that we'd like to start with. Trying to advance my slides here. Oh, there we go. Okay, so this session outline today, the first part we're going to do an introduction to our topic, a little bit about our grant, the specific aims of our research, and our methods. The second part is going to be about parents, media, and new technology use. Part 3 will be about parents' understanding of news messages about pediatric injury research. And part 4 will be some of our preliminary recommendations for injury prevention professionals and communication specialists. So part 1, while news coverage of pediatric injury studies appears to be a useful way to disseminate information, we really don't know a lot about where parents typically access such information and whether they understand the messages about injury-related studies, whether they further disseminate or share these findings, and how they make decisions based on the information that we're providing in these sources. So the first aim was to really answer the question, where are parents going for this information? And the aim related to that was to determine parents' media access and use patterns to enhance the dissemination of pediatric injury research findings. And our second aim is really to answer the question, how? So are parents understanding the news messages about pediatric injury research findings? And our expectation is that by the end of this project that we'd have a better understanding of the types of media that parents access, as well as how they understand and use that information, and that we expect that this research was going to generate some valuable information for us as a field, as injury researchers and communication specialists and others who disseminate these pediatric injury research findings, including how we can enhance that dissemination by informing them what media channels should be targeted, what types of messages can be easily understood by the target audience, which in this case is parents. To frame this issue a bit more in terms of significance, there's a growing concern about the need to increase the capacity of injury prevention and control programs. And I know as part of SABR, we've had lots of discussions about how to do this. So we know that that's kind of framing this issue a bit. Specific injury issues need to gain momentum through tailored outreach that would effectively reach specific audiences. And news coverage of pediatric injury studies is really just one way to disseminate information widely about these new interventions, new findings, new programs, new practices, new recommendations. And although parents are a significant audience for this information, as I mentioned before, really little is known about whether they currently access or understand news stories about these topics. So as many of you are aware and probably participated in the publication that I'm going to talk about, the CDC released a guide for communicating about injury in 2010, Adding Power to Our Voices, a framing guide for communication about injury. And the guide was for injury and violence prevention professionals to use to develop messages that would benefit their injury-specific topic and then the field as a whole. So we're sort of taking that framing guide a bit further with this work and attempting to understand where parents go for that information and to make certain that we're putting our information in places that parents go to and that we're developing the messages to promote our findings in a way that they'll understand and value. And I don't think we could truly or completely address this issue without thinking about health literacy. And although our findings around health literacy and the differences based on health literacy level, that was a focus of this work, we are not going to be presenting those details today in this webinar. We're going to give a broader picture and more of a preliminary look at our research. So at this point, I'm going to just talk a little bit about our approach, which was to do two major research activities. One was an online parent survey. We used a survey panel group, and there were eligibility criteria for parents to participate. They had to be at least 18 years old. They had to be a mother of at least one child, less than 6 years old. They needed to live with that child at least some of the time, and we didn't want people to answer the survey on a smartphone, although having a smartphone was obviously something we asked about. And we had over 1,000 mothers complete that survey. And it asked about media, internet use, health and injury information sources, health and injury status and experience, and other sociodemographic variables. And then a second approach that we used was to get a little more in-depth with focus groups. And we did 6 focus groups. We had some low, middle, and high income quotas that we filled for our focus groups. These, again, were mothers of children less than 6. And in both cases, the online survey and in the focus groups, we had people watch actual news clips. So those links were made available to you prior to the webinar and would be available to you to watch afterwards. But the two videos that people watched in the online parent survey were about car seats and household cleaners. And then the three videos, the news clips that they watched in the focus groups were car seats, high chairs, and household cleaners. So at this point, I'm going to throw the mic over to Jen, who is going to present on part 2, Parents, Media, and New Technology Use.
Hi everyone, how are you? Thanks for listening in today on our webinar. So as Lara said, I'll be talking about some of the results of our online survey. One of the first things I wanted to show everyone just has to do with basic internet and cell phone usage, because when we start talking about disseminating messages to parents, we need to know what kind of access they have to different technologies if we would like to use those technologies to help us do that. So just to point out, there is a typo here. So it's actually only 2% did not have a home computer. And almost everyone who had a home computer did have high-speed internet access as well. And almost everyone had a cell phone. And of those who did have cell phones, most also had a smartphone. And we were also interested in social networking sites. So we asked about having a Facebook profile, since that's currently the most popular SNS. And almost everyone reported having a Facebook profile. And while there were moms who had profiles on other sites, that number was a little bit lower at 63%. So it's important just to mention here that obviously when you're doing a survey with an online sample, these are moms obviously who have access to the internet and are probably heavy internet users because they've become part of this online sample. Now, some companies do use strategies where they will recruit people in other ways and bring laptops to the home and things like that. But in general, the online samples do tend to be heavy internet users. But we're okay with that, and I'll explain why as we get towards the end of this section. So as you can see, everyone had a lot of internet and cell phone access, but what we were also interested in had to do with different internet and cell phone type activities. Just because someone has the internet or someone has a cell phone or smartphone doesn't necessarily mean they're using all of the different capabilities of that technology. So what you can see here is the most frequent types of activities had to do with text messaging, using social network sites, and using email. And then those were all in the 70% range when reporting out how frequently they did it, and so that's where people said several times a day. We also had a few other categories as well, like once a day, several times a week, once a week, and less than once a week. But they're not reported here just for ease of looking at the numbers. And you can see from the never category, and sorry it's a little bit skewed on this slide, that for those first three items, text messaging, social networking, and email, almost everyone is doing those activities in our sample. When we start to move to some of the more specialized technologies, we see these numbers shift a little bit. So you can see that there are fewer people reporting that they do these things several times a day and more people reporting that they never do them. So of these, the blogs were the most commonly used newer technology. Things like Pinterest, which is an online bulletin board site that's heavily used by moms, online forums, Twitter, sharing videos online, and things like video chats are definitely used less frequently. And so this is important to understand when we're thinking about using these technologies to reach people. We want to be thinking about the things that are going to have the most visibility and heaviest access among moms with young children, if that's your population of interest. And so this gives us a little insight here as to what kinds of things that might be best to use in terms of the media channels to reach them. We then asked about health information seeking. So just because people are using these different technologies in their daily lives does not mean necessarily that they're using them for health information seeking. So we wanted to specifically find out more about this. So first we asked a question focusing on traditional sources of information. So we asked them, other than a health provider, what were their preferred sources of health information? And as you can see, the internet was overwhelmingly listed as the first choice by most people at 85%. And just after that, friends and family came in with just over half of the sample. once you look at those top three kind of, health providers, obviously a lot of people use the internet, friends and family, we start to see a big drop off. So things like TV, books, magazines, brochures. Yes, the moms report using them, but they're used much less frequently as a preferred source of health information. We then wanted to find out more about these more specialized technologies and whether those are used for health information. And what you could see here is that the percentages are a bit lower. So again, we see blogs near the top of this list. So about 40% of the moms saying other than a health provider, that's a preferred source of health information. 28%, so almost a third, saying none of these things. And then you see some of the other percentages. So in terms of some of these newer technologies, yes, they're being used by some moms for health information, but are they being used by enough moms to make them useful channels for disseminating injury prevention messages? That's something that we need to really think about. We then specifically asked about injury information seeking because this obviously was an injury study. And this time we did not exclude health providers, so the way we asked the question was to ask moms their two most important ways of getting injury prevention information. And even here you can see the internet topping the list at 76%. 44%, so just under half, said health providers, and then friends and family, and again the percentages dropped substantially for the other sources. So I think what this really says to us is that moms really see the internet as a significant health information source, at least the moms in our sample. And even when we're talking about something like injury prevention information, the internet becomes really their primary source. So that's, again, very important to think about. Now, obviously, when we say injury prevention information, it's hard to know what different moms think that means. We tried to give some examples in the survey, but moms could really interpret that differently. So another thing we did in the survey was to provide a list of specific health topics and then asked about preferred information sources. So what I have here in this table are the 3 different injury-related topics, but we also asked about things like ear infections, sleep issues, and immunization. So what you see here, again, very similar in that the internet becoming the primary source of information well above health providers for things like bicycle helmets and car safety seats. Now, what's interesting when you look at poison prevention is that you see a little bit more of a split here between internet and healthcare providers. My hypothesis about this is that even though it's listed as poison prevention, so we're thinking more from an injury perspective of how we can prevent poisonings, moms are probably thinking, oh, well, gee, if my child just got into a bottle of something cleaner, I'm going to call my doctor right away. And so I think that's why we're seeing health provider here a little bit more. And when we looked at things like immunizations and ear infections, which again are a little bit more medical in nature, we saw a much higher percentage of healthcare providers being listed as the primary information source, followed by internet. So when we looked at all the topics, really what we see is the most kind of acute medical type issues, healthcare providers the primary source, and as it moves down towards some more kind of general health issues that are not necessarily acute medical condition type things, the internet becomes the most common source. So really when we're talking about injury information, we have to recognize that a lot of moms are going to the internet. Now, this can be a great thing because, as we know, there's a lot of great information on the internet, but we don't really know from our study whether moms are going to a site like NHTSA or a mommy blog to find out about something like car seat safety. And I'll address the issues about that in a couple of minutes. So finally, the other thing we wanted to show you was some data about social networking. We know that a lot of moms really share information, and we want to understand this a little bit more. So we asked the moms that if they find interesting or useful information related to their children's health on the internet, do they share that with other moms? And almost everyone said yes, which I think is not surprising here. What we wanted to know, though, is how they usually share it. And we asked them to check all that apply here, so the numbers obviously will add up to over 100%. But interestingly, a lot of the moms said that they share that information when they see them in person. But after that, it was through social networking sites. So what I think is really interesting here is that while social networking sites were not listed as a main source of health information, they're sharing the information, health information, with other moms on the social networking sites. So they may not be perceiving the fact that they're going to Facebook to search for specific information, but the fact that so many moms are reporting that they actually share health information on Facebook shows that they actually use that channel to spread information and to share it with other moms, which means that other moms are getting health information through Facebook. So again, just even how you ask a question or how the moms think about the question can really have an impact on what we're finding. So this gives us a few things to think about in terms of getting out injury prevention messages. So as I mentioned, because moms are on Facebook quite a bit, but they have a low preference for getting health information that way, doing something where we rely on Facebook to disseminate study results may not be a great strategy. However, if we start to think about ways that we can use social networking to share the information, that might work better. So in other words, if we have kind of a leader who has some blog, a lot of moms share blogs, for instance, and then there's some blog entry about car seat safety, and that's a blog that's commonly linked to through Facebook posts. And then one mom finds it on Facebook and she thinks it's interesting, so then she shares it with other moms. We're really thinking about more of a trickle-down effect as opposed to, oh, if we just have a injury prevention group on Facebook, all the moms will like it and read it. I don't think that's going to work, but somehow tapping into the social networking piece, which is really the strength of social media, is something we want to consider and think about. So the other thing is, you know, considering what media channels are best for distributing messages, and what we're seeing really is, as you saw in the data earlier, that the internet is really become the most prominent channel for information and for message distribution, and things like TV, radio, things like that are really at a much lower percent now. Does that mean we should use those channels? I don't think that's what it means, but I think we need to make sure we're using multiple channels to reach people. Now, again, to think about the fact that this was primarily an online sample. And earlier I said, why was that not a problem? Well, the thing is, if we're talking about disseminating injury prevention messages through the internet and through newer technology channels, that's only really going to work for those moms who are heavy internet users or heavy smartphone users. When we start talking about certain populations who may not be online as much and who may not be using a lot of those technologies, we're gonna have to think about other ways to disseminate the information to them to begin with. So I think what we're focusing on here is for the moms that are heavy internet users and heavy smartphone users, how can we really harness some of the energy and the frequency that they're using these things to get out our messages in a better way. And the other thing to think about is that social networks obviously do not just exist in social networking sites. So yes, I may have friends on my social networking site, but I also have friends in real life that I talk to and see, and maybe they're not on Facebook or something. So another idea is to really think about how we can use those heavily connected moms to get the information to them, who then may spread the information to their other mom friends who are not heavy internet users. And just to give you an example, I was doing some data collection with Head Start moms where I live, and one of the questions we asked those moms had to do with, you know, if they had the internet access at their home. We asked them, you know, do most people you know also have internet access? And while some moms said yes, there were quite a few moms who said no. So they seem to be a higher technology user than others in their social network. So trying to take advantage of that could be a really great strategy that I'm not sure we've really taken advantage of before. So that pretty much wraps up what I was going to talk about here. We also did some work in the online survey using different kinds of news item stimuli and asking questions about those. And we had some great results, which we're not presenting here, but we did a lot of that to inform the focus groups, which we did after the survey. And Kate's going to take over now to talk about that part of our research.
Thanks, Jen, and hello, everybody. Thanks so much for being here today and sticking with us. I'm going to turn our attention now to presenting some initial findings from the focus group work that we did as part of this study. So in addition to the foundational information that was gathered in the online survey that Jen just described, we also felt that there would be a great deal that we might learn by getting moms together to watch the news clips to ask them some questions about what they got from those news clips, and then to stimulate some discussion about the topics and the issues that were presented. And essentially that's what we did in the focus group part of this study. And the quote that I have on this slide from one mom in group 2, I would say that anything that relates to childhood safety is important, really kind of gives you, it's just one illustration, it's just one example, but really that was the tone of all 6 of the discussions that we had. The moms were really, that came to the focus groups were really engaged in this issue, in this subject. They generally understood the main messages of the videos. They often said that they learned something new and found the information to be important and believable. And for most part, the participants considered the information that they were presented with on the news and delivered in these stories to be credible. So next slide, please, Lara. So to give you a little bit more background on the focus group study and what we did, we conducted, as I said, 6 focus groups. These focus groups were conducted in Columbus, Ohio, which was convenient for us given Dr. McKenzie's at Nationwide Children's there in Columbus. We worked with a market research firm to help us with recruitment and also sort of provision of facilities for the focus groups, which worked very well for us and made this really feasible. The focus groups were all conducted earlier this year, in the spring of this year. And in order to be included in the focus group, we had moms in these groups, and they all had to have at least one child who was younger than 6 years old. And as you'll see in the next slide, many of the moms had more than one child, and some of their children were considerably older, which raised some issues and some interesting issues for the discussion. So not only did we want diversity in our sample in terms of income, we also wanted to recruit a diverse group of moms, but we wanted to have focus groups that in some ways had moms who were in a similar income position together in the same group. We thought that that would be important in terms of the discussion, and because depending on the resources available to families, you know, it structures how you may react to recommendations, for example, as we saw in our discussion, recommendations for particular products or car seats, or I'll discuss that in a moment. So we had 2 groups of moms who were from families that had incomes of lower than $30,000, 2 groups of moms whose households had incomes of between $30,000 and $50,000, and then 2 groups where the household income was more than $50,000. We showed all 6 of the groups, all 3 videos, news clips of injury stories, and we varied the order. So no two groups in the same income bracket saw the videos in the same order, because we thought, and as we found, that there was some sort of building of discussion based on, you know, different discussion when you've seen 2 or 3 stories and when you'd only seen 1. And these were somewhat unusual in the format of the focus groups, because we actually collected some individual level data after we showed the video before going to the group discussion. So we, as I said, we showed all 3 stories to all 6 groups in different orders. And after showing the story on a TV in the room to the whole group together, we asked the mothers to complete some assessments of what they gained from the story, what they thought the most important parts were, and to do that on their own before coming together to discuss the story and what they thought of the issues as a group. And I'll present some data on both the individual responses as well as the group discussion. Next slide, please. So a little bit more background about the participants. There were 49 moms who took part in the study. On average, they had 2 children. Several of the moms had many more. The average age of their children was just under 5 years. The majority of the moms were between 30 and 39 years old. The majority of the moms were white. Ideally, we would have liked to have a more diverse focus group set of moms, but our sample is what it is. We also had a relatively highly educated group of moms. About 40% of our moms had a college degree, and 4 out of 5 of the moms had some college. So as I said, a pretty educated group overall. Most of these moms were working moms. The majority, just over half of the moms were married, and over two-thirds of the moms were in two-parent households. And these were also a highly connected group of moms. Like our online survey, most of these moms had smartphones, 9 out of 10 of them. Next slide, please. So a little bit about the news clips that we showed the moms. We showed the moms real news stories. So we showed them the clips that we've shared with you, which were stories about injury research, new findings, and recommendations that had appeared in actual news coverage. We used TV news stories rather than other formats because they were easy to show to a group. They're engaging. We could show them on a TV, and in some ways what we wanted to really generate was discussion of the issues rather than get into the specifics of how moms engaged with stories, and that might be in a print format or in a web format. So we really then showing stories that had appeared on network TV worked well for our purposes. The injuries topics that were selected matched the injury priorities of CDC and were in line with our grant. And 2 of the 3 stories that we showed were actually stories that had been produced in relation to research that had been published by Nationwide Children's Hospital. So next slide, please. So what did the moms, when we asked the moms about what they could recall and what they valued in the news stories, what did they tell us? Well, what we see on this slide is that what I want to draw your attention to in this slide is that for 2 of the 3 stories, that is the story on the high chair and the car seats, only about half of the moms recalled the injury statistic that was presented. Whereas in the poison video, about 4 out of 5 of the moms correctly recalled the injury statistics. So we gave the moms a couple of different options of numbers that pertain to the story that they've just seen, and they had literally just seen the story. And for 2 of the stories, only about half of the moms could recall the story. What's interesting is that in the household cleaners, the poison story, the statistic had actually been presented visually, and we wonder whether that helped the moms to remember and recall this information, and that's something that's perhaps worth more consideration and follow-up in future studies. So although there may have been some issues in recall of specific numbers, there was, we saw little indication of difficulty in recalling key information, injury-related information that had been presented in the story. So in the 2 of the 3 stories where there was information about the source of injury, almost all of the moms correctly recalled this, and the injury sustained, similarly, in the 2 stories where there was information about this and we asked about it, almost all of the moms recalled that correctly. And similarly about the new guideline. When there was discussion of the new guideline, the moms could recall what the new guideline was. So next slide, please. So from our discussion that followed each of the videos, there I think was something revealed about why it is that some of the moms, or about half the moms, didn't recall the statistics. And it seems like numbers, the women in our study, there was a great variation in the extent to which the moms thought the numbers were important and really engaged with the idea of numbers. So in this first quote, this is sort of an example, an illustrative of something that came up that was mentioned by many of the moms. It's by no means was just this mom, that numbers are important in terms of sort of situating yourself for a story. So this mom said it's good for the numbers a little bit to show how many kids might have accidents and to be more careful, I guess. So this mom valued the numbers, whereas the mom from focus group 4 said, I think really the numbers don't really matter because sometimes, I mean, lots of this stuff happens by chance. So you could imagine that for a mom that's saying that the numbers don't really matter, that might be something that, she's not trying to retain out of the story. Next slide, please. So now, what were the moms interested in these stories? These were, stories that were, I think, pretty compelling stories that had a strong narrative component, and also dealt with significant and important injury topics. So what engaged the moms in these stories? And we asked the moms what did they find to be the most compelling. And there were 4 options that we're reporting here. Whether they found the story about the child, each of these stories, as I said, each of these news clips had a strong narrative element about one specific child as an illustration of the type of injury that was being discussed. There was also information about the number of injuries, as I talked about the statistics. There was also information in the stories from an expert, so some information about the injury topic. And then there were also recommendations provided in these stories. And we wanted to know what, after watching the story, what did the moms see as the most important thing. And in 2 out of the 3 cases, the moms were really most engaged with the story itself, with the story about the child. So the narrative component was most compelling to them. In only 1 case, for the household cleaners, was the number of injuries the most compelling. And again, I think there's some more work for us to do in understanding whether the way of presenting the number was contributed to this, or was it just the number itself that that was really compelling. And we also noted here that for all 3 stories, fewer than 1 in 5 mothers were the most interested in the recommendations. But I'm going to give you some more. I'm going to talk in just a slide or 2 a little bit more about how the moms felt about recommendations, and the fact that most of the moms didn't see this as, or very few moms saw this as the most compelling element, is not to say that they didn't find the recommendations to be valuable. In fact, they wanted more information and more specificity around recommendations. So it's just that it was the story that captured their attention, and then they also saw value in the recommendations. So next slide, please. So what did the moms say? They engaged in these stories about specific kids. What was it about the stories that were compelling, and what got them engaged? And this the first quote here from the discussion illustrates the importance of the choice of the specific story. So this is a response to the car seat story, and it's just how, and this is illustrative of comments that were said in each of the groups about this story, that this was a heartbreaking story, and what stuck out to me the most was the little kid. So in this case, this was just a very engaging and compelling story. In contrast, the second quote here is in reaction to the high chair story, and one of the moms said, "This is probably going to sound horrible, and you never want a kid to get hurt, but the little girl seems so fine that maybe if you'd shown a worst case or a scenario, maybe that would have been more effective." And this was something that actually, again, didn't come up in just one of the stories, but the idea that that in this particular case that there was some distancing of the moms from the story on the basis that the specific example that had been given may not have been severe enough or to have connected with the moms in the most compelling way. So next slide, please. And so finally, what did the moms tell us about the recommendations? By and large, they told us what we didn't see was, and what we were really pleased not to see in these groups, was resistance to recommendations and distancing, explicit distancing from the advice and the recommendations that were being provided. So in only one case did we see, did a mother report, and this wasn't to the group, this was reporting by writing down that they wouldn't follow the recommendations that were shown. By and large, they either were already following the recommendations, and in over half of the cases, the moms said they were already following safe practices for storage of household cleaners, and almost half of the moms said that they're already keeping their child rear-facing up to age 2. There are cases where even though the moms were had a child under the age of 6, they didn't see the topic as particularly applying to their child. So it wasn't that they were rejecting the recommendation, but a car seat or a high chair, it just didn't apply to their particular child anymore. So by and large, the moms saw the recommendations as useful, and if it would apply to them, they intended to follow it. And we were also very interested that the moms expressed a desire for more information. In the high chair story and in the car seat story, over half the moms desired more information that was provided, which also may suggest that, to us that, for example, providing a link to a source for more information, providing that link or a phone number where people, or a source of more information, as well as just the information itself as the end shot for a news story might be something that we would want to think about working with news outlets for, given that these moms really reported wanting more information. So final slide, please. Okay, so this is just a little bit more insight into this issue about what the moms told us about wanting more information about current recommendations. So from one of the moms in relation to the car seat story, she says she wants more information because her son is still under 2. I mean, he'll be 2 next month, but she still wants to check it out because she'd assumed until seeing this that he was okay being faced forward because of his height and weight. So she wants more information than was provided in the story. And in the second clip, it's in relation to the household cleaners and the poisoning, sort of what would you do in that kind of situation. The moms in particular in relation to this story really wanted specific information about specific poisons about, and what they should do should this happen to them or someone else in their family. So I think these were incredibly valuable focus groups. The moms really were really engaged in discussing these stories. They gave great sort of personal insight into how they engaged with these stories, and I think it was an invaluable additional piece of data collection to supplement our larger survey work. So thank you.
Hi, this is Lara again. I'm going to wrap up the last part of our presentation, and then we'll be happy to take excuse me, questions and open up for discussion. So this part, I was going to summarize for you some of our initial recommendations for injury prevention professionals and communication specialists around these topics. So just kind of going back and summarizing, what did we learn from the online survey? So we learned what sources are really valuable and what parents are using or particular moms are using. Internet heavy, smartphone users, they're connected. And then some of the lesser utilized sources are maybe blogs, and the sharing, social network sharing is something that we could dive into a bit more. So I think we need to think about when we frame messages for use in these different mediums, you know, we may have a slightly different tactic, I guess, from that approach. Or that's a really big takeaway from that, but there is a lot more detail from the online survey. So, and I'll let Jen have the mic back in a second to add on to any of that. But again, summarizing what we learned from the focus groups, and Kate did a great job of giving a really high-level view and also some detail of what some of the moms told us. But based on what we learned from the focus groups, mothers generally understood the main message of the videos, and that's really important. They felt like they often learned something new, and that they found the information important and believable. And that's really important to us if we're seen as a credible source of information for parents, so that the information is not dismissed or sort of put aside. And for the most part, participants considered information on the news and delivered by the people featured in the videos, some were doctors, some were injury specialists, and some were both, to be credible. So the effectiveness. Participants found the stories to be more effective when they perceived that the children's injuries to be more severe. So as Kate mentioned, the car seat and the high chair injuries, there's really a difference there. If you were able to view the videos ahead of time, you saw that the child that was featured in the car seat video was really severely injured, and the child in the high chair video had more of sort of what we consider minor bumps and bruises from her fall from her high chair, as you may expect. Those two mechanisms are quite different. But there was a lot of strong reaction to the child not appearing to be that severely injured. So I think for us as a group who's maybe putting these pieces together and finding families that will really connect with our audience, figuring out sort of that very delicate balance between a child who had a severe injury but maybe not a death, because I think that could be off-putting to parents, but also not a minor enough injury that it doesn't make an impact. So that's a really delicate line, and it's a challenge, I think, to find families who are both willing to participate, share their story, be featured in a news piece, and then also have all that criteria that we're looking for of like your kid was severely injured, but they're okay now. So that's something I feel like we can walk away with trying to figure that out. We found out that the visual information that's communicated is really important. So communicating a point and, visual information that clearly communicated a point and surprised participants, such as the crash test demonstration or the comparison of household cleaners to desirable foods or beverage products, was really effective. So when you can illustrate something visually to people in these pieces, that's really helpful. The numbers. So, I think we've struggled in our field for a while about how do we present this risk information. Does social math help us? Does the presentation of these risk statistics help or hurt? And the individuals varied in their extent to that they perceived the number of childhood injuries presented in the clips to either be large or small, if they remembered them at all. So I think that's an important point. Behavior change, and I think this is a really important piece for us ultimately, because we are wanting to share our studies, promote our research, but in the end we're trying to get people to make a behavior change. So most of the mothers said they intended to change some aspect of their behavior or would have in the past. So some of the kids that we were asking them about maybe were sort of aged out of that particular recommendation. So using a high chair, they were older than a high chair, older than would be using a high chair. And for the rear-facing car seat recommendation, which was the focus of the car seat video, they may have been aged out of that recommendation too. So but the important point is that they would have changed some aspects or would have in the past after watching these videos. Similarly, mothers were most likely to share the car seat recommendations, while many would only share the advice about the household cleaners and the high chairs if they were in a specific relevant situation. So some of the moms said, if I was at my friend's house and I saw such and such, then I would bring it up. And so I think we need to kind of get a little deeper into what makes social sharing of injury information acceptable, and maybe what are some polarizing topics. Things that come to mind that aren't injury related are breastfeeding versus bottle feeding, or co-sleeping versus not co-sleeping, or vaccination versus not vaccination. And I think some of our injury topics may be falling in that polarizing black hole, but how can we make them okay for people to talk about? We did see some income differences based on their reactions to the videos across the income levels. We didn't get into a lot of detail with our presentation today about that, but it is one of our findings that we're going to explore some more. And while the mothers in the lowest income groups may have been least informed based on their responses, their reactions to the videos were similar to other groups. So what are some of our limitations? And of course we have them like every other study, but we're acknowledging, we used a panel for the online survey, and that is, a different kind of method for gathering your sample than other methods would propose. We conducted our focus groups only in one city, so they were all from a sample of people living in Columbus, Ohio. And 2 out of the 3 video clips, as was mentioned previously, were produced by our institution. So we've got a sort of prescribed way of producing these clips. Although these, the ones that were shown were the TV station's sort of interpretation of that clip. So I would also add, like, some of the strengths for this study and our methods were that we use real new stimuli, so that's something that's not typical by my understanding, and Jen, you could jump in here to support that, but use of real new stimuli is something kind of innovative here. And let's see, let me just finish up with one slide and then we can open up for questions. But this kind of leads me to some of the things I was alluding to of what can we do better. So I think it's really important to find a match between injury research findings or between injury and the research findings, and also the type of injury that's shown or depicted and the findings that are most important. Another really important point is to show a family or a patient that's portrayed and what the sociodemographics of that family are. There was a little bit of resistance to the family portrayed in the high chair study because the kitchen was very, they seemed to be a very well-to-do family, had a really nice-looking kitchen where the child who was pictured was sitting at a nice kitchen island in a very fancy high chair, and there was a little bit of reaction to that. So making sure maybe the families that are portrayed or the sociodemographics that are portrayed are kind of not one end or the other, perhaps. We should always try to provide recommendations and actionable steps, because although the sort of reason that we get these news findings featured in the media may be that there's a new study, a new finding, a new way to look at some injury topic, this is, I guess, at the heart really a public service announcement, or can be used that way, because we need to give people what the actual recommendation is and what the actionable steps are. And I think we're going to miss opportunities if we don't do that. So we have to, as injury researchers who are being interviewed or featured in the pieces, make sure we have those recommendations as part of the piece, whether they're shown on the screen, whether they're part of your talking points or some other illustrative way. That's really important. We have to consider who the credible sources are for your target audience, and there was some reaction to a doctor that was featured in one of our videos versus an injury researcher featured in another, and how people, view that as credible or not credible. And then we also, in the end, I guess, want to ensure the messages about complex ideas like risk are easy to understand, and they are really difficult concepts, and if we're going to go there and present those pieces, we want to make sure people, really understand what we're saying. Okay, I would like to, that's sort of the end of our presentation. I'd like to open up for questions and also ask my presenters to maybe chime in on things I forgot to mention. I'm sorry, but right before I do that, I did want to mention what I failed to mention at the beginning of our presentation was that this is a collaboration not just between researchers at 3 different institutions, but at 2 CDC-funded injury centers, at Hopkins and here in Columbus, and I think this is hopefully a way that we can bring together different expertise on a similar topic and advance the field. Hello, hello, anybody out there?
I see a question in the chat about asking the moms if any children had an injury for the focus groups. We did ask that in the survey, and I'm just trying to.
We also asked it in the focus groups. We started off. That was kind of our icebreaker question. So we asked moms to talk about injuries, and that's, I think, will be an interesting, that got moms oriented to the group and to one another. And some of the moms talked about fairly minor injuries, and then some had stories of really horrific events that had happened in their families. And I see a question about where can you find the videos in the focus group, and those were distributed to the registered participants, so you should have gotten those earlier today.
They will be available as associated with the audio recording of this webinar too, as far, is that correct, Robert?
I'll just, while we're waiting for a response to that, someone asked about how we got our focus group. So we worked with a market research firm and who have panels of willing participants, including moms, and yes, they were given an incentive to participate.
I see another question here that I think is really important to address about social networking between moms, and while sure that could be a great strategy, as we know it can also be very problematic when the information is inaccurate, and as we know a lot of this has been seen with the immunization and autism type issues. So that's one of the things that we really need to figure out what we can do better. So for instance, is there a way that we can harness blogs, try to find very popular blogs that get cited about and try to do more with working with those blog writers to get credible, accurate information in there to get that information spread. So thinking about really innovative ways to partner with some of these people who are out there creating this content, I think is really, really important. I know when I see individual posts from friends and they're citing things that I'm like, uh-oh, this is not good, I'll try to comment on it, but it's hard for all of us to be able to moderate that. So I think trying to go to the source of some of this and even maybe developing a blog that could be seen as a really credible and accurate resource would be a really important strategy. I see another question related to the survey about whether the healthcare provider could have included calls to a poison control center. We did actually think about that, but we did not specifically ask that. So that's something certainly that could have been possible. That and again, this is a problem with surveys. I mean, moms could interpret healthcare provider in a lot of different ways. And another survey-related question I see here is about looking at the quality or accuracy of the information that moms access on the internet. We did not do that. That requires a lot more time-intensive data collection, but what I'd like to do in the future is to spend a little more time delving into that, because I think that's really going to be the key to a lot of what we need to know and how we can best disseminate the information.
And I saw a question about non-English speaking parents, and I think that's a key area of research. We didn't include non-English speaking parents in our focus group and in our focus group study, and I think it's a really important area for research, not only in terms of understanding where parents get their information, but how they react to information that may be communicated in a language that they're not particularly comfortable in, and I think that would be a great follow-on study.
And another follow-up study, I think definitely including fathers or other caregivers is really important, and we specifically focus on moms in this work, but in work in all areas, I just think that's a real need, and so definitely that's something that we would want to do in the future. I mean, a lot of people I know have stories where, their moms takes care of the kids for the day and they go to put the kids in the car seats and it's a whole situation going on. So I think that looking at other caregivers is really important. Someone asked about credibility, and I think another issue there is yeah, I mean, some people could be going to what we might consider a credible source like a health provider and not getting accurate information. And another thing that's really important to think about is people have different views about what they perceive to be credible. So while we may tell someone, oh, well, if you go to the CDC website, that's the most credible website you can use, some people don't view CDC as a credible website. So that's something that's really tricky, and my thought on that is trying to meet people where they are so that we can at least just try to get them the information they need, but how to do that is definitely a challenge. That's a really good question.
There was a question about have we published our findings yet. So we haven't published these findings yet. This is really our first sort of public presentation of some of our results. We're currently analyzing these data and for several different manuscripts, but we also plan to produce a report that would summarize some of these recommendations as well. I saw another question below about the credible sources. Was the MD more credible than the researcher? In fact, it was actually the opposite in a couple of cases, or specific comments related to that one study. Let's see. I'm just trying to read the next question here. Literature support different ways of, I'm looking at the question about child fatality review. Jen or Kate, do you?
I don't know. I'm sorry.
Excuse me, I don't know. No, I'm sorry, we don't have an answer for that one. That's a good question, though.
And then I think the final question there, Lara, is about the report being posted on the CDC site.
We would be happy if they wanted to post it there. We haven't finished the report yet, so but I'd be happy to reach out to them to share it that way if they're interested. I mean, since this work was funded by the CDC, I'd hope they would want to promote it that way. We'd be more than happy to do that. I did have one sort of announcement for one of the pre-conference workshops that's being offered for the SAVOR conference. Tracy Meehan from our center, who's the manager of translational research and is highly involved in promoting the findings for our center, but also helping to package some of the research and the ways that we do this. She's going to be offering a pre-conference workshop that would help people learn how to do some of the things that are mentioned in this webinar in terms of putting these news pieces together. So that's just a nice tie-in there if people are interested. So I think we're nearing the time to close the webinar, and I just want to thank SAVOR again for allowing us to present our findings, our preliminary findings, and I want to thank my co-presenters, and yeah, we're looking forward to the next phases of this where we can publish these findings and share that report, and I thank you for all your questions and feedback, and that's really helping us think about what we might want to look at in more depth with our work. Thanks, everybody.
Okay, this is Robert. I'll go ahead and sign everyone out, and thank you for listening. Thanks to our presenters for this valuable information, and for all those who are listening, check www.savorweb.org/webinars with a capital W. There'll be archived information and slides there. Thanks, everyone.